I think that both CTCs and ctDNA have clear value for the staging of patients with myeloma. In fact, for the staging at different stages. And the reason I say this is because there is more and more interest for accurate predictions of patients with precursor conditions at risk of developing active disease. And this can only be achieved by longitudinal frequent testing, and longitudinal frequent testing requires the ability for testing using minimally invasive methods in samples other than the bone marrow aspirate, and therefore the interest for CTCs and ctDNA in those patients with precursor conditions. And then the MRD setting. Patients fortunately are living longer and longer, some of whom even with treatment-free intervals, and therefore there will be more and more interest to know what is the remission status of the patient down to the MRD level. And we cannot work in a scenario in which patients will have bone marrow aspirates every 6 or 12 months for years and years until a potential disease progression. Again, this requires high sensitive methods for minimally invasive assessment of MRD, and there again I think there is promising data showing the value of CTCs as well as ctDNA.